Hello, my name is Eric Warriner. I'm a second-year PT student at Grand Valley. I have two opportunities for clinicals this upcoming fall. They both span over 9 weeks. The first clinical rotation starts on August 4th and ends on October 3rd, 2025. The second rotation would start on October 13th and end on December 12th, 2025. I would like to participate in a clinical rotation at the Sports Academy because I love working with the athlete population. In my first clinical rotation, I found my favorite patients to work with were athletes returning to sport or training for a sport-specific goal. I enjoyed treating the athlete across the lifespan, whether it was a high school baseball player rehabbing a torn labrum or a 6-year-old with patellar tendonitis who was training for a half marathon. I feel this clinical opportunity would give me more exposure and experience working with this population and will allow me to improve my skills as a clinician. My goal following PT school is to apply and participate in either a sports or orthopedic residency. I would like to specialize as soon as I can because I have found this area of PT is where my passion lies. I love treating the musculoskeletal system, and I'm fascinated in the mechanics of the human body and how injuries occur and how they can be prevented. My goal is to help as many athletes as I can return to their sport and rehab a significant injury. An activity and experience in my past that I feel would help me thrive in a sport-specific PT setting is that I've dealt with many running-related injuries during my time as a collegiate cross-country and track athlete at the University of Toledo. I know what it feels like to have to rehab a significant injury, so I feel like I would be able to empathize with a patient or athlete going through something similar. I had 2 femoral stress fractures that kept me out of competing for an entire year, so I know the patience and consistency required to be able to safely and effectively return to a sport. This past semester, I was also a graduate assistant at Grand Valley, in which I tutored anatomy and kinesiology and biomechanics to first-year students in the program. I found this experience as a graduate assistant prepared me and improved my ability to teach and educate people about human movement and apply it to clinical situations. In the highlights of the application, it says there are opportunities to be on the field with athletic trainers, which is something I hope to gain experience in with this clinical opportunity. I have yet to experience or observe what it is like to be on the field as a physical therapist, so I hope to learn how the role of PT differs from athletic training and how we can best help and support each other. I would like to look forward to gaining experience as working as a team member with other disciplines at the Sports Academy as well. I also hope to learn more about some of the specialty services provided at the Sports Academy. Video running gait analysis and throwing analysis are 2 things I'm very interested in, and I would like to learn more about that technology and how it is best used to serve patients and athletes. What I hope to gain the most is just improving my hands-on skills in clinical decision-making in the sport-specific setting. I feel this experience would allow me to see a wider range of sports-related diagnoses and injuries and help me add more tools to my toolbox and learn new skills to address patient needs that I have not necessarily experienced in the typical outpatient orthopedic setting. I'm very comfortable working with athletes in a high energy and fast-paced environment. I'm a very fast-paced, active, and productive individual. I experienced an environment similar to this on my first clinical rotation and gained experience working with multiple patients at a time. I feel I was prepared for this because either the night before or in the morning, I would write down goals I wanted to accomplish or new things I wanted to try with the patients I was seeing for that day. This helped me have a plan in place and know what I wanted to do ahead of time so that I didn't overwhelm myself in the moment. I felt that I was able to transition between patients efficiently, and I feel that I can continue to improve this skill with this clinical experience. In a team setting, I typically view myself as a leader. When there is a task at hand, I like to outline clear objectives in order to meet goals. I'm a very organized person, and I like setting a plan out for myself and the team that will best help us succeed. I like communicating with the team and assigning roles where everyone knows what their job is and that there's no confusion. Some qualities I look for in a teammate include honesty, trust, dependability, passion, and a hard work ethic. You need to be able to trust the person next to you and know that they have your back. Honesty is also necessary for open communication and effectively having important discussions, especially when talking about making difficult decisions. Everyone should be comfortable sharing their thoughts and opinions, and a good teammate truly considers other people's input. I also feel having a passionate and hardworking teammate is important because then you know they're putting their heart into something and giving their most complete effort. So that is my introduction to who I am and what my goals and past experiences are. Your consideration is greatly appreciated. Thank you so much.